My name is Abbey Kaler. I'm a nurse practitioner and a supervisor for the Advanced Breast Cancer Program at MD Anderson. The inspiration for the ABCDE project really came from patients themselves. Patients living with advanced breast cancer were the inspiration behind designing a program specifically to support the quality and quantity of life for our patients living with advanced breast cancer. And so, as we began working with our advocates to understand the needs and the challenges that they have, we quickly learned that it is crucial to have advocates involved from the beginning of the research design. And as we were brainstorming this process, it became clear that the advocates desired an educational training to be able to participate as a member of the scientific research team. And so from that realization, both on the part of our patient advocates living with advanced breast cancer or our caregivers for those with advanced breast cancer, as well as the scientific research team, we said, this is an opportunity to be able to really learn here from the experiences of our advocates before they completed this scientific training to be part of the research team. And so that was, in short, the inspiration behind the project. So when we conducted these semi-structured interviews with patient advocates, we really wanted to capture the essence of their experience. And so our questions were open-ended, and we really allowed for patient advocates to expand. And so one of the barriers that our patient advocates often expressed was that they needed to know and to feel that they were adding value to the research itself, that they were able to balance the demands between being a patient, going through active treatment, as well as a member of a scientific team with recurring meetings, et cetera. And that it was really important that there was flexibility for them to be able to participate because not only, pursuing their treatment plan and everything that comes with being a cancer patient and making sure that they're taking care of themselves, but then also the demands of being a member on a committee and meeting the requirements and meeting schedules, et cetera. And so in summary, we learned that for our patients to be able to participate, it's really important that we make sure that advocates are aware of their role within the program, that they feel confident that they can fulfill that role, and that the schedule of meetings or deadlines is really conducive to where they may be within their treatment plan. And so in addition to barriers to facilitate barrier, sorry, so in addition to barriers to participation, we also learned about facilitators. What makes patients want to participate as part of the research team? And so we called these facilitators to participation. And this was for our advocates to feel that they received adequate training and that they understood the scientific jargon that was being discussed at some of these meetings, or that they felt comfortable to say, hey, you guys, hold on, wait, could you please back that up and explain it to me? And having the opportunity to be able to make sure that they were understanding of what was being discussed. And that they had an avenue for ways to ask their questions, whether they felt confident, raising their hand within a meeting, using the chat bar, using email to coordinate, after a meeting occurred or during the development of a proposal. Each patient advocate had their preferences, and that it is really important to take into account those communication preferences and styles. And then lastly, patients felt that they really wanted to be part of a collaborative environment, and that researchers felt the need and the importance of including an advocate from the beginning. They wanted to feel needed and that they were, again, adding value to the research design. So after we completed the interviews, our patients did complete the Stanford Medicine Public-Led Opportunity Training, or we called it PLOT for short. And this training was a 12-week training that was offered through online modules that our patients were able to complete at their leisure, but within a pre-specified time frame. And really, it included everything from Research 101 to implementation of clinical trial designs to what is the institutional review board, what is the protection of human subjects, all of the baseline information that would be needed to facilitate participating in a research project. It's really important that patient advocates are included from the inception of an idea, because it's really important because only the patient knows what it's like to be a patient and to experience participating in a clinical trial, participating in a research design. And so who better than the patient advocate to really share that expertise as the trial is being developed, as the design is out for brainstorming. And so that is how we can ensure that our trial will ultimately be successful, because we have taken the forethought, we've taken the opportunity to consider the needs, the desires of our patients, and really to be able to facilitate the best care possible is an opportunity that our patients are actually able to participate in. And so that insight that we gain from having advocates join the conversation from the beginning is invaluable. The biggest takeaway would be to be open-minded and to consider all viewpoints, and really to understand whether it's your institution or your practice's process, and how logistically and best to have advocates participate in that structure, because we know that everyone's institution or office is different, and so being able to utilize these lesson learns, but also to be able to modify them for your unique environment, and really giving yourself the grace and the flexibility to be able to do that. This work was completed after 5 or 6 years of brainstorming. So it absolutely did not happen overnight. And there were lots of conversations and lots of proposals that got us to this point. But knowing, that every one of those experiences was valuable and led to the next to ultimately have a successful project. So now that we have completed our ABCDE project, as we call it, so we have written a manuscript detailing expanding upon this poster that we submitted and presented at ONS Congress. And so we're hopeful for the publication of our manuscript, further detailing the facilitators and the barriers that our patients experienced, and then really hoping for the next steps to be, okay, well, now that we know the facilitators and the barriers, let's implement that into when we begin new projects projects moving forward, because we want to make sure that, one, our patients want to participate and that we do everything in our power to be able to meet the unique needs that they might have, because they are such an invaluable part of the discussion and planning process. I just look forward to more institutions recognizing the need for patient advocates to participate and utilizing this information to, within their own institution or framework. And, really look forward to collaborating and really making sure that our trials are feasible for our patients to be able to participate in.